Hey guys, welcome to ECU and Brody School of Medicine. I would like to introduce you to the Pediatric Residency Program Leadership. My name is Dr. Sarah Leonard and I'm the Program Director for our residency program here. I have been Program Director for about the last year. Before that, I was the Associate Program Director for a few years. And it's always been sort of on my radar to be the Program Director, so I'm super excited to be stepping into this role. I am from North Carolina. I pretty much grew up in the Raleigh area and really had never been to Eastern North Carolina until I came here as a visiting student my 4th year of medical school to check out the program. It worked out that my fiance at the time was a medical student here, and we thought we'd check it out and see if this is where we were meant to be for the long term. And when I came here as a student, I just fell in love with it. I was super impressed with what the hospital and what Greenville had to offer. It's totally where I saw myself being. So I was happy enough to be able to be here as a resident. I learned so much during my residency here, was super happy and comfortable, felt really connected with the faculty and the community, and decided to stay as a chief. Then I went to another North Carolina school for my fellowship, but before I even left, said that I wanted to come back as faculty, so was happy to be able to get on as faculty here after my HEMONC fellowship. So now I've been back as faculty for about 5 years. So there were a lot of things about this program that made me want to come back as faculty and as a member of the program leadership. So I think one thing that I really loved as a resident but sort of took for granted was just the relationship with the faculty and the residents. The faculty are super supportive of the residents and really excited about education and mentoring. And I loved that while I was here, and it kind of took me going some other places and seeing what it was like in other areas to realize that that was actually really unique and really special about this program. So I loved the idea of being a part of a faculty that was really invested in resident education in addition to excellent clinical care. So that was one reason. I think the other part too for me just as faculty was I wanted to be somewhere where I could be involved in research and kind of cutting edge medicine and evidence-based care, but I also still wanted to have a connection with my patients. So I think here I was able to get the best of both worlds. Like, we have this large academic medical center, but it feels very much like a community hospital, and the faculty and the residents are super invested in the community and our patients, and just making things better for the community as well. So I wanted to be somewhere where coming to work every day wasn't just, a job and a box to check, but actually kind of a mission and a service for the community too. So our faculty is really supportive of the residents. I think one way, just in simple ways on a day-to-day basis, just being approachable and open to questions. I think that's one of the best ways to learn and develop as a resident, is to be able to ask your mentors and your teachers questions and feel comfortable doing that. So try always to be open and supportive in that way. I think also just with the ability that we have to be mentors. I think we encourage our residents to have mentors in many different arenas. I think one of the strong points of our program is our advisor program. All of our residents have academic advisors and are supported in that role, but we also encourage them to have mentors in any other arena, and that may change from time to time. So they may have kind of life mentors depending on what they need, or study mentors if that's the need at that time. So I think that's definitely one way our residents can feel supported. It has a lot of strengths. I think our faculty is a huge strength. I think everybody is so invested in teaching. We have a lot of faculty like myself that have trained here or done some portion of their training, whether it's medical school or residency, and come back. So they all feel very invested in the residents. I think the residents are another strength. I'm constantly blown away by just how wonderful each class is and how much of a family they become. I remember my residents, my class, we used to do family dinner nights and game nights, and I know those things have continued on. So I think it blows my mind how wonderfully the match works out every year to just bring us this group of residents that is so excited to be here and work so well together. I think another strength is just our community. Our patients are just so wonderful, and a lot of them are really needing the care that we provide and are so thankful for what the residents do for them. So I think that works both ways, that we love being able to care for them and they're so appreciative to have us here. And then I think another thing is just the community. It's such an easy place to live. We love living here. We have 3 young children now, kind of at different stages and in schools. And I think Greenville, even though it's kind of a small town, it has everything that you need and all the benefits of a larger town, just without the traffic and the cost of living. And it's been a really nice place to raise our family and to grow in my career. So I think it's been great. I think having been here as first a student and then a resident and chief and faculty and now as program director, I have been in all of those roles, so I know exactly how it feels. And I think as program director, still having only been in the role a year, it's sort of all new and a little bit surreal, honestly, but super exciting because I am so glad that I get to be in this role and be here for the residents. I think one of my main missions as program director is to be accessible and just make sure that the residents know that we are here for them. Like, it really is a family. I know that seems kind of like something a lot of programs may say, but it really does feel like a family here. Like, we want to be here when the residents, are excited about something. We want to be able to share in the engagements and the weddings and the births of babies, but we also are here to, support the residents when they may struggle, whether that's academically or on a certain rotation or something in their lives. So that's what I want to be. I want to be a program director that everyone feels comfortable coming to with help in any of those areas, to share with joys, and then also, though, to help you, the residents, stay on track and be able to accomplish everything they want to be and do and have the career of their dreams. So that's what I'm hoping to accomplish.